Did you hurt yourself playing golf, tennis, or other activities? Chronic pain? Call 561-600-HURT. Live pain-free. Call today.
Hi, I'm Dr. Ian Goldbaum, and you've been watching Live Pain-Free.
Back pain at the acute level is now in the office of anesthesiologists, which to me is a wonderful addition to your practice. Keep going if you would, Doc.
Sure, absolutely. So, historically, one of the most common problems that we've seen is back pain with sciatica. The pain that's going down the leg.
Down the leg.
Down the leg, right, exactly. And that's usually caused by either a herniated disc, disc that's pressing on a nerve, or more of a degenerative problem causing spinal stenosis, where just the canal or the space around the nerve has gotten tight, and that's just squeezing the nerve. So, one of the most common things we've done is epidural steroid injections, which is one of the most common procedures done in the United States.
For years and years and years.
For many, many years.
Right, decades.
At least 50 years.
But most people, when they hear about this, and again, we're not talking about most people that aren't keeping up, but most people, like traditional people, think about that when a woman's going into labor, oh, we'll give her an epidural. That was always when you heard of epidurals, but they're really much more prevalent in the care of back pain, aren't they?
Oh, absolutely. In fact, probably that's how we started, because we started giving epidurals for labor and for surgical procedures. And we were just injecting large volumes of local anesthetic to numb the nerves so that the patient can have surgery or have painless labor. And what happened eventually, about 50 years ago, they discovered, hey, you have these steroids. If we take cortisone, which is a very powerful anti-inflammatory, and we put it into the epidural space, we're going to relieve the swelling and inflammation of these nerves, and the patient's going to feel better, and that's what's happened. And kind of our whole field has evolved from that very simple concept.
You can see the number if you want to get in touch with either Dr. Stein or his partner, Dr. Schaja. All you'll have to do is call 561-600-HURT, and we'll be glad to get you in touch with these fine doctors. We were talking earlier in the show, Dr. Schaja in particular, about cortisone-injected epidurals. But I want to kind of move a little bit further into something that I find more exciting, which is PRP and stem cell therapy. And the reason is because I've been involved in it for a while. I've had a procedure myself, and I also know a lot about some of the celebrities that have had to leave the country and go for secretive kind of stem cell therapy. Now, we've all heard in the public about stem cells are this magical thing that can just form any kind of cell it wants, and it's wonderful. But then we also have the other side, which we're not going to address, is where they come from. And what we're talking about with you folks and in the future is taking the blood from yourself, taking the stem cells, and kind of like in the old days when everybody was scared of HIV, we would infuse our own blood before surgery so that in case we needed it. This is your own blood, patients, right? This is coming from you, going right back into you, so there's no risk of anything. And the government now has FDA approved stem cell therapies as well as PRP therapies. So whether you're Kobe Bryant or Peyton Manning and you're heading over to Germany, you don't have to do that anymore. Can you guys fill us in and fill our viewers in about those two kinds of procedures, please?
Sure. Stem cells and platelet-rich plasma, which is what PRP stands for, is really about utilizing the body's own natural resources to promote healing. So if there's an injury to a joint or a sore muscle or a tendonitis, we're using the body's own resources to help heal. As you know, with epidural steroids in general can be harmful, and there's lots of potential side effects.
Right.
They could break down tissues and actually cause harm to the body. But what we're trying to do with using stem cells and PRP is actually utilize your own resources in a concentrated form, spin down a sample of blood, extract the platelets that contain these growth factors, and then inject that in a concentrated form into an area of inflammation.
Directly into the site.
Directly into the site.
That's what we're excited about it for. Instead of stuff going all over your body, you're focusing it in,
Right there.
right in the spot, under fluoro or under ultrasound, depending on
Always under image guidance.
Under image guidance, and so it hits. And so that helps to make sure that the exact amount gets where you want it. And that's made a tremendous move forward.
It's a remarkable thing.
So what kind of results should people expect? Like, I had PRP on my knee, and I'm an overachiever when it comes to not listening to what my doctors tell me and did too much, but I'm still much, much better off than I ever was before. I'm no longer in pain meds, I'm no longer wearing a brace, and it's been almost 2 years now. So I'm pretty pleased. What do you see as the best usage for it?
Well, certainly for acute injuries, if the people are not healing with simple physical therapies, with anti-inflammatory medications, there's patients that are going to go on for surgeries, and we all know how many patients have had surgeries and continue to come back to us for treatment of pain.
Surgery just didn't do it.
Right, and spine surgery, with all due respect,
Right.
is still a problem because patients continue to have problems. So we're trying to find alternative ways to treat pain effectively, and utilizing the patient's own resources seems like the most natural thing if we can accomplish that.
Did you hurt yourself playing golf, tennis, or other activities? Chronic pain? Call 561-600-HURT. Live pain-free. Call today.